This is Dr. Carrie Cathenese, PhD. She is well, not anymore. She is a licensed therapist at TAES, where she provides psychological evaluations, therapy, and autism navigation services to children and caregivers at the TES Fairlawn Clinic. In the past, Dr. Cathenese has experience providing individual, patient, and family therapeutic services, along with parents, to early childhood and school-aged children in a variety of settings. Additionally, she has professional experience doing psychological evaluations with early childhood and school-aged children in school, residential treatment, and outpatient settings. She enjoys spending time with her dog, Leslie, hoping one day to have her become a certified therapy canine. Thank you very much for attending. And Dr. Cathenese, it's your stage.
All right, thank you so much. So it's nice to, I was going to say see all of you, but I cannot see all of you, but it's nice to be here with all of you. So thank you so much for taking the time to join. I'm excited to be here with the Autism Society. So I was going to introduce myself, but Wendy did such a great job already. And before that GIF kind of gets us dizzy, I'll send it away. But just like Wendy had said, I was completing my postdoctoral training with TES. I started in 2019. And so I've recently just met all the requirements to be a licensed psychologist. So I've just as soon as September, I've met those requirements. And so I'm staying in my role there. And some things that I do there, psychological evaluations and therapy, but one of the roles that I have there is also autism navigation. So working with parents for kids who have been identified as having autism and being able to provide supports, make sure they're connected to different supports. And so that's a little bit more about me. So thank you, Wendy, for the good introduction. And then we will move on and get started. So as you all know, we're here today to talk about executive functioning and how it relates to autism. And so just to kind of remind everyone of what we're looking to learn today, defining what executive functioning is, and also just kind of being able to know what some of those related skills are, learning about how those skills develop over time, and also how those skills kind of relate to everyday living and how they can kind of impact our day-to-day living and our overall well-being. So kind of how they're important in everyday living situations. And then also just kind of talking about ways that we can foster executive functioning skills, especially with individuals with autism. And so my hope today is to be able to send you off with just some strategies and be able to foster some of those executive functioning skills, whether you're a parent, a caregiver, a therapist, a teacher, whoever you might be working, a related service provider, whoever you might be working with, that you can have some broader or general strategies. And like Wendy said, we will have time at the end for questions. If they're very specific, I might not be able to answer them just because likely I have not worked with, the child that you might have in mind, but hopefully we can give you some good strategies, kind of broader general ones that you can take with you moving forward. So with that, we'll go ahead and get started. So we'll go ahead and start with the definition for executive functioning. And so really research kind of agrees on a broad concept of executive functioning. And so that's the first bullet point here. So executive functioning is kind of the overarching regulation of goal-directed, future-oriented, higher-order cognitive processes. And so that's kind of a mouthful. So to break it down a little bit, it is helpful for us to kind of talk about it, how it applies more to our daily life. So really it can help us manage projects. It can help us kind of determine the actions that we need to take to meet goals and move forward with goals and with projects. And so basically it can help us analyze things, stay organized, schedule things, complete tasks, whether within a timeline or just completing tasks in general. So really, Barkley has said he's studied executive functioning and extensively, and especially for how it relates to ADHD. And so overall, kind of some key take-home points are that, executive functioning can really help us organize our thoughts and activities, kind of prioritize tasks, manage our time efficiently, and also make decisions effectively. And then also executive functioning has been linked to the frontal lobe as early as 1973, which is right there conveniently. So that's about as far in depth we need to go into that. I mean, there's a lot of, other more in-depth neuropsychological processes that happen, but typically executive functioning has been historically related to the frontal lobe of the brain. So then just kind of talking about more about what executive functioning looks like. And so you might be wondering, what specific skills are kind of included in that term executive function. And it really kind of depends. So there's a lot of theories out there, a lot of different models of executive functioning in research. They could be cognitive models, clinical models, behavioral or neurobiological frameworks. And so my goal today is to not bore you by explaining every single type of model that's out there. So we're just going to kind of take a more simplistic approach. And again, Barkley, who is a big researcher in executive functioning, he has identified kind of 7 core executive functioning components. And so I have them listed there. So the first one being self-awareness. So that might be more like self-directed attention, inhibition, kind of your ability to use self-restraint. So kind of stop impulses or, manage impulses and things like that. Nonverbal working memory, which can be the ability to hold things, specifically visual imagery in your mind and kind of be able to manipulate it. And along with that would be the verbal working memory. So kind of your self-speech or your internal speech or things of that nature. Emotional self-regulation, so your ability to kind of take the ones that we just mentioned, those executive functions, and be able to use them to kind of manipulate your own emotional state. So kind of learning how to use words or images or even your own self-awareness to kind of process or alter how we feel and how we can express that and regulate that too. Self-motivation is a little self-explanatory. So how well you can motivate yourself to follow through on a task and to complete it and see it through to completion. And then planning and problem solving, so also called self-play. So that's really how we kind of play with information in our minds to kind of come up with new ways of doing something. So really like planning solutions to problems is really what that last one would be about. So moving forward, executive functioning skill deficits may look like some difficulty with starting or completing tasks. So maybe an individual who is struggling with executive functions might really struggle to initiate a task. So they might need some external supports to be able to start a task. And then also to see it through to completion. So maybe some external supports there, whether it's prompting or, having adults say, you need to get this done to finish and follow through on a task. Following directions, making sure that we're able to attend to what people are saying to us and being able to understand what they're saying and, again, complete them. Time management, so being able to know how long it might take us to complete a task and also to be able to kind of prioritize things appropriately and get things turned in on time on a deadline. Forgetting information, so that doesn't necessarily mean all information, but sometimes with executive functioning, a lot of times what could be typical for kids is, or for adults or anyone who might have executive functioning difficulties would be, I'm giving you 2 or 3 things to do, but maybe you remember the first one only, and then you're kind of forgetting the other 2 or you're getting distracted or things like that. Again, regulating emotions or impulses, so being able to manage your emotions or your emotional reactions, and then also, being able to inhibit some responses, so inhibit those impulsive behaviors. Keeping track of things, that could be an area where maybe you're misplacing things or you don't have all the materials needed to start or complete a task, or you don't know where those materials are. And then planning for future events. Also stringing actions together to meet goals. So being able to know, here are the exact steps that I need to take to achieve this overarching goal. And then analyzing and processing information. So these are all areas that can be impacted if you are having executive function skill deficits. I do want to note too, some of these things can be caused by other things. If you have anxiety or depression or symptoms of those things, it can be hard to follow through on things also. So, just keep that in mind. Today, obviously, we're talking about executive functioning, but some of these skill deficits can come from other types of things that might be going on as well. So then we'll talk a little bit about how executive function relates specifically to autism. So as many of us know, or as many of us might already know, autism spectrum disorder is a developmental disability that can cause significant social, communication, and behavioral challenges. So individuals with autism may communicate, interact, behave, or learn in ways that are different from other individuals. And so this can really impact the way they learn, they think, they problem solve, and it can really vary from person to person. So that is something to keep in mind as well. And studies have found that there are executive functioning impairments in some individuals with autism. So it has been linked in research. And specifically, executive functioning skills like working memory, shifting, and fluency have been found to be impaired in individuals with autism spectrum disorder. But there is also research to show that there can be improvements made in executive functioning for individuals with autism spectrum disorder. And so that's something that we can talk about today as well. So there's hope on improving some of these things in the literature. So then we'll talk a little bit more about executive functioning autism specifically. So some things, some relative strengths and weaknesses for individuals with autism. They might be able to see details really clearly, but then really kind of struggle to put those details together to see the whole picture. So that's one way that, that executive functioning weakness might be there if everybody's struggling to see that big picture. Individuals with autism may be really great at following schedules or routines, but then they might really struggle if those things change. So kind of being able to shift or adapt to unexpected changes if those routines or schedules are broken. Kind of similar, on a similar note, individuals with autism might really be able to understand or even recite back, rules. And they might be able to understand them and follow them, but then being able to kind of cope and regulate emotions related to when some of those rules might be broken, either by themselves or by someone else. There could be difficulties with focus, motivation, impulses, working memory. All of those are some of those executive functions we've already looked at on the previous slide. There could be difficulty with communicating wants and needs. And then there also can be, kind of working with abstract ideas might be difficult as well. So maybe they're really good at understanding concrete objects or ideas, but then again, those abstract things might be more difficult. And so some of these might apply to people with autism and some of them might not. So again, everything is different and it can vary. But especially we might be able to see some of those emotion regulation difficulties when some of these things are thrown at us. So, or an individual with autism. So that's something important to keep in mind as well. And then this is just me giving you all a thumbs up because I'm throwing a lot of information at you at the beginning of the session, just telling you what executive functioning is. And so, just giving you positive reinforcement. And so now that we know what executive functioning is and what some of those deficits could look like or what some of those skills could look like, we can talk about kind of how it develops and then why those skills are important. So looking specifically at executive functioning development. So according to Harvard University Center on the Developing Child, we are not born with executive functioning skills, but we all are born with the potential to develop executive functioning skills over time through interactions and through practice. So that's important to note. According to Barkley, our friend who does all the research on executive functioning and how it relates specific to ADHD and things like that, he has identified some core timelines that executive functionings can develop. So they tend to develop in that in the sequence that we looked at before. So self-awareness would be the first one, and then they kind of gradually build on each other. So that can start as early as age 2. But then kind of the last skill that we had looked at on the other slide, the planning and problem solving, those can develop as late as age 30. And so I think that is something, again, important to note, because when we're talking about these skills, a lot of the individuals we might be working with might not be at that age yet. And so that's important to know that some of these skills really aren't fully developed until we're in young adulthood. And I do want to say too, in some of Barkley's research, he has found that individuals with ADHD or ADHD-like type symptoms are likely to be about 30 to 40% behind their peers in transitioning from one executive functioning level to the next. And so this is why children or adults who might be neurodiverse have more difficulty managing kind of age-appropriate situations. They might be thinking or acting in ways that seem like younger than their actual age. And so this is why it's really important for us to consider developmental age when we're working with people on executive functioning skills. And then really just that last bullet point, executive functioning can be affected by environmental factors. So there's some research to show that early childhood stress, family structure, and educational opportunities can all affect the way executive functioning develops over time. And this means, though, also that these skills can be amended over time. So we can kind of give some of those experiences or practice, and we can kind of help to foster some of those skills over time. So they can be practiced and they can be strengthened throughout those experiences when they are applied. So looking at the importance of executive functioning skills, we use them every day. So that's one of the things that we bump into, is that that's why they are so important. During play, kids might use them by taking turns. They might need to share with peers. They might need to attend to and follow directions from adults in order to be successful. Socializing, you need to focus and pay attention to what people are saying to you while they're talking to you. You might need them while you're working through issues or finding solutions to problems, organizing events or gatherings if you have some of those skills there. And then at school, obviously, too. So managing time properly, turning in assignments, completing assignments, paying attention to new learning material, keeping your supplies and materials organized. So obviously, these are important to everyday life, and we use them every day. And so there are opportunities to practice and further develop these skills at school and at home. And reinforcing these skills kind of across settings, or kind of generalizing them, can also increase an individual's ability to further maintain and develop these skills. So that's one of the important things to consider, is that we want to try to generalize these skills across settings, so that we're not just learning them in one setting and then not being able to apply them in another. So we want to be incorporating these skills wherever we can in our daily routines. So just more ways that executive functioning is important. So again, from the Harvard University Center on the Developing Child, executive functioning can play a role in school achievement, positive behaviors, overall health, and in work success as well. So executive functioning, again, can help children remember, follow multi-step instructions, kind of avoid distractions, control responses, adjust when changes are made, persist in problem solving, and manage long-term assignments. So that's how it can relate to school achievement. Executive functioning skills can help children develop kind of teamwork or leadership, decision-making, goal-oriented behaviors, critical thinking, adaptive, being able to adapt from one situation to the other, kind of being aware of our own and also others' emotions. So that's where those positive behaviors kind of tie into. Executive functions can also help people make positive choices about nutrition and exercise. And it kind of helps to prime our biological systems and coping skills, especially when we're responding to stress. And then for work success, it can increase our ability to kind of stay organized, again, problem solve, plan ahead, and adjust to changing circumstances. So not too surprising there, based off of how we talked about how they can impact us on a daily basis. So I just want to point out some misconceptions. So, obviously, based on the information we just talked about, we could see where someone with executive functioning skill deficits might struggle on a day-to-day basis if we're struggling to plan ahead or stay focused or stay organized or manage our impulses or emotion regulation and things like that too. So we can see how that might affect our daily life. But, the Harvard University Center on the Developing Child did note just some common misconceptions too. And so research shows that by 12 months of age, a child's experiences can help lay the foundation for ongoing development of executive functioning skills. So that ability to focus, pay attention, control impulses, actively hold information in our memory, that can be disrupted by adverse experiences or biological disruptions as well. And so this means that some of these difficulties might not be outgrown on their own, and that we do need interventions aimed at improving these skills to kind of help foster those skills. So it might not necessarily be something that's just outgrown for people who are neurodiverse, or for other individuals as well who might have experienced some of those disruptions to executive functioning development. Another misconception is that, obviously we know as someone who is showing executive functioning skill deficits can show some very challenging behaviors. So they can become off task, they might lose control of emotions, they can be easily distracted, and sometimes individuals with these deficits and some of these behaviors can be blamed for those things as well. And in most circumstances, I'll say most, not all, that prefrontal part of the lobe of the brain that we looked at earlier is usually the thing to blame. So it's not usually the child. It's usually, this is just a skill that they haven't been able to develop yet. And that kind of working on some of those skills with them, being able to either make adjustments to the demands that we're placing on the individual, or providing supports or interventions or things like that, is usually more successful than punishing children for some of those things. So really, especially when adverse experiences or environments have caused a stress reaction, people who have really well-developed executive functions might struggle to manage with some of those things as well. So we just want to keep in mind that, executive functioning skill deficits might make kids off task and might make them struggle in some of these areas. And so we want to just be able to intervene rather than to punish. And so that's me giving you all a high five this time, because we got kind of through the background information of the executive functioning information. And so we're going to move on to probably the part that I think everyone has been waiting for, which is what do we do about this to improve it? So I will go ahead and stick to the next slide. So I do have just a couple of minutes of this TED Talk that I wanted to share with all of you. So just a few minutes. This is by cognitive scientist Sabine Doebel. And so she just gives us a few important considerations when we're working to improve executive functions for our children, our clients, our students, whoever that might be. So we'll kind of move on just to one other kind of important consideration to think about when we're thinking about working on improving executive functioning skills as well. She kind of already mentioned in the TED Talk video that they're not quick fixes, and so along with that too, executive functioning interventions are not one size fits all too. So I'm going to be throwing a lot of strategies or things out at you, and so some of these things might be helpful for you, and some may not, and that's kind of with any intervention, right? We want to find a best fit, and so again, remembering that context is important, but also, different children or individuals might respond very differently to different interventions or strategies. And so some of the suggestions I might even give you might not even be feasible or might not even be appropriate for some kids, depending on their skill set or their situation or their environments as well. An example would be, she kind of talked about in the TED Talk a little bit about, some of those computer training programs. And although there are some computer training programs that do have some research behind them, if there's a very intense computer training program to work on some of these skills, if a kid with also anxiety is doing that type of intervention might really stress them out. If it's a very, fast moving, very intense computer program, and they also have symptoms of anxiety, that could be not a good fit for them. So we just want to think about what's appropriate for the people that we're working with. And so going off of that, we want to utilize kids' strengths and their vulnerabilities. So we want to use their strengths to help them build up some of those skills, but also we want to consider, where some of those weaknesses are. We want to work in that zone of proximal development. So we want to make sure that we're teaching them something that's challenging enough that they're learning something new, but it's not so challenging that they just can't, it's so far above where their skill set is right now, where they're going to get frustrated or they're not going to take anything away from it as well. But at the same point, we don't want to make these things too easy for them too, so they're not learning anything. So there's that zone of proximal development where we want to just make sure the things that we're doing will help them enough that they can learn that new skill without, the frustration and things like that. We also, again, want to consider the family needs and functioning. Really caregiver and family member support, shared experiences, even time spent working on some of these skills together can be one of the best outcomes for kids in building their executive functioning skills. So they can be some of the most effective and long-lasting interventions when caregivers are involved. And so children are more likely to build executive functioning skills with adults in activities in which they can practice those skills. They feel like the caregivers are able to model them effectively. They can be supported by their caregivers. They can trust them, and they can feel like they can have that guidance from being dependent to being independent. So that is one thing to consider as well. So just talking kind of broadly about some different interventions for executive functioning, and these truly are interventions. So these would be something that a professional would be working on with someone who's trained in some of these strategies would be working on for individuals who have executive functioning issues. So not necessarily something that we would be doing, not a parent, or if you haven't been trained in it, these would be things that you would seek professional guidance from. So there is research to support that different neuropsychological, educational, and socio-emotional programs can be helpful. So people who are trained in mindfulness, mindfulness training really is the practice of bringing one's own attention to the present moment to kind of know what we're doing, what we're feeling, and think it without judgment. And so these can be adapted to children of all ages. And so some of the strategies that professionals might use in mindfulness or even just simple breathing exercises, body scanning, gratitude, kindness towards oneself and others. These strategies can really help with concentration, memory, and emotion regulation. Other programs, I know we talked about some computerized programs. I think she was talking more about apps that don't have research backing them. But so there are computerized programs out there that do have research that show that there's been improvement in executive functioning skills. So cognitive training or neurofeedback programs like CogMed or MyDear involve several sessions that target executive functioning skills like memory and impulse control. Again, there is data to say these interventions are effective, but kind of going along with the issues of generalizability that we talked about earlier, there are questions about that. How well does that apply to the real world then? If we're learning it on the computer, is it able to be generalized to using in everyday situations? There are school curricula out there that also target executive functioning skills. There's programs called Tools of the Mind or other programs that work on teaching self-regulatory and socio-emotional skills through play and through cooperative learning. So they might be learning things like taking turns, active listening, developing creative ways of problem solving. Schools can also give different interventions to work on different executive functioning skills. So it doesn't necessarily have to be a curricula or a program like that as well. There are people who are trained to work on building executive functioning skills also in the school as well. Even physical activity. So aerobic exercise, yoga, even organized sports like soccer or basketball can help promote executive functioning skills. Since children or individuals will have to hold rules or strategies in their minds, kind of adapt to changing situations or actions, and then kind of monitor their own performance. And also just physical activity itself can help promote emotional well-being, which in turn can also help with executive functioning development as well. So moving on to, again, general executive functioning skill building and kind of workarounds too. So as the research has shown, just a couple of these strategies. So these are kind of things that are more general that we can kind of take a more active role in, that you can help with individuals who might have executive functioning deficits. So direct instruction, so directly teaching kids executive functioning skills. So, teaching them the steps for desired outcome, directly teaching them how to use time management or organizational tools, teaching them how to complete certain tasks. So that's something that we can all do. We can demonstrate, we can teach, we can role play some of these things with people with executive functioning deficits as well. So again, those role playing or kind of talking through multi-step problems or challenges can kind of help with planning and problem solving skills. Setting up practice challenges is something we can all do too. So everyday tasks like thinking about clothing. So washing, drying, folding, putting away clothes, those all require multi-step, multiple steps in order to achieve those goals. So, if we work on some of these skills in a low stress environment, so whether that's at home or at school, wherever a kid might feel like they can kind of take the time to learn some of these skills in a lower stress environment, those are things that we can practice, and we can set them up for kind of these practice challenges before we're wanting them to try to practice some of these skills in the setting that we would like to see it occur in. Social stories can help, especially when unexpected problems arise. And then apps to manage time. So alarms, visual timekeepers, different types of visual supports can also kind of help with managing some time and things like that too. Additional general executive functioning skill building and workarounds, visual reminders and schedules, having pictures might be helpful. If you're trying to keep things organized and you want items put back away in a certain place, putting pictures on the places where those items go, or words, labels or things like that can be helpful supports or workarounds. Having schedules, and again, just making sure that we're giving that direct instruction for how these things are to be organized or used as well, because we want to make sure if we're using schedules or calendars or things like that too, that the individual knows how to use that. Breaking things down, modifying tasks or assignments, those are really big workarounds that we can all do as well to kind of help children or individuals with executive functioning deficits. So kind of making things more manageable. So kind of going back to when we talked about, we might give a list of things to do or say a list of things to do, and then maybe someone with executive functioning difficulties might remember the first one. So want to break it down, instead of giving 4 or 5 things to do, maybe 1 or 2. And then Also, prompts if we need to, pictures if we need to, modifying it in any way, just so that it's more manageable and that the individual can succeed and can kind of work on building those things up. And so once they're able to do 1 or 2 things, that's when we can kind of add 3 or 4 onto that as well. So we want to kind of slowly work up those kinds of skills. And then lastly, just rewards or recognition for those appropriate skills, or for working really hard at those appropriate skills. So making sure that we're acknowledging that success, or that they're trying, or that they've made this accomplishment as well. That can be helpful as well. So I will talk about some strategies from the autism community in action. They had a really great infographic here. So these are some things that we can all do at home to kind of help develop or foster some of those executive functioning skills. So again, thinking about planning and organization, and thinking again about, developmental rather than age, of, where your individual skills might fall, and what things that they might be capable of taking on and learning. So again, if we're looking at calendars or things like that, teaching them how to use those skills and keeping them in areas where we can see them, where they can be reminded, so making sure it's in sight, so they can remember to check them. If we're using checklists, making sure that it's understandable to the individuals we're working with. Do we need pictures on our checklist to complete things? Do we need words? Do we need both? But then also, trying to use strategies for time to complete those tasks as well might be helpful and useful too. Visual reminders by the door. If there's items that you need before you go to school or before you go to work or wherever you might be going, placing those visual reminders somewhere in a high traffic area where they might see it before they're walking out the door can be helpful. If we're working on keeping things neat in the house, labeling where things belong and showing those labels, or demonstrating, modeling, this is where this goes. Again, breaking those large projects or chores down into smaller tasks. And then if applicable to your situation, planning something, let's plan something. Let's plan a day out. Where are we going to go? What are the hours? So kind of taking all those steps to plan a successful night out in a supportive way as well. Self-regulation. We as adults can model a lot of these skills for kids. So we can model calm behavior. We can model, talking in a calm tone of voice, taking those deep breaths. We can model a lot of those things. We can use that positive reinforcement when we're seeing good self-regulation skills. We can give options and choices for things. So I think a lot of times, especially for self-regulation, if someone's having a really hard time regulating, it can be a safety issue. And so, we can say, stop doing that. I want you to stop. Giving those choices of things that kids can do in that moment. So, we're saying what we don't want them to do in that moment, but giving those choices of here's what you can use in that moment can be a good way to kind of foster some of those skills. You can pick this or that, and giving them those choices of things to do to help regulate themselves can be helpful as well. Sensory input, asking for help when needed, suggesting a quiet area or building a quiet area where they can go to kind of self-regulate might be helpful as well. Labeling emotions as we see them can help, and just acknowledging, yes, I see you're struggling, I see you're upset, I see you're angry, can be helpful too. And then when they're calm, if they're able to, be able to talk about some of those feelings if you're able to, but visuals might be helpful, especially for coping strategies. So if we need to have a visual, almost like a menu of things that we can do when we need to self-regulate, things that can kind of help us calm down, that might be helpful as well, just so that they can remember those choices and use them. Some board games can be helpful for working on executive functioning skills. So they offer a whole variety of things there on that list. One for sure for emotional regulation, I feel like is always, very stressful, is Chutes and Ladders. I feel like, it's always, if you get the chute and you have to go down, that can be so frustrating. So, kind of working on some of those skills through game can be entertaining for kids, but also it could be easier to generalize if they're working with other kids on some of those things. But even things like Uno, where you're matching, you have to pay attention to numbers or colors or things like that. Even matching games, those can be good ones too. So I know they have a couple of different ones there. Sequence Junior is also a good one too, for being able to keep track of things as well. Chores, again, these are things that often involve multiple steps and kind of remembering what steps need to be completed. So kind of starting with simple tasks and then working up to complex or multiple steps or chores can be helpful. Again, the visual reminders or cues or checklists, and then giving that assistance when needed, or being able to modify things if needed as well. Working memory, really for working memory, one of the biggest things is that visualization. So being able to see it in different senses, or, being able to see it, or being creative. So giving those visual supports so that they're not having to rely solely on just memory. Asking for clarification. So if you're giving a command, either asking for that to be repeated back to you if able. If not, we can model those things, or we can prompt those things. So those are just different ways, or we can provide visuals to kind of prompt some of those things as well. So just remembering that visuals can be helpful too. So moving into, the Harvard University Center on the Developing Child does have a PDF handout of different activities to exercise executive functioning skills throughout ages. Again, just keep in mind, developmental appropriateness for these. So they look specifically at age ranges. So for early childhood for them is about 0 to 5. But again, remember considering the developmental appropriateness for strategies when we are thinking about some things that you would want to try. So lap games, hiding games, imitation or copying games, simple role play or finger plays are some things that they suggested kind of help exercise executive functioning. That could be peekaboo, can work working memory, but also kind of self-control skills. You're challenging someone in early childhood to remember who's hiding, and then also to kind of wait for the person to reveal themselves. Pat a cake or other predictable rhymes that give that stimulating, but an expected surprise at the end can help with working memory. They can also develop familiarity with the rhyme and kind of practice anticipating a surprise and kind of inhibiting a response while they're, highly stimulated. Hiding toys or having children hide themselves or hiding objects kind of challenge working memory skills. So kids have to keep track of, remember what is being hidden, and then keep track of search locations and things like that as well. Imitating or other challenges that really have children kind of keep track of others' actions, remember them, wait their turn, recall what others did. So that really practices your attention, working memory, and self-control skills. This could be things like waving, we'd want someone to imitate that, organizing toys in a certain way, and then having a child copy you. So maybe we're putting all the dolls in the dollhouse or all the cars on the car garage for organization and things like that. And we can model those things so that they can be imitated. Building things with blocks and having kids imitate those things, or even, showing, here's the horse galloping and those kinds of things. So, but also taking turns in any activity. So like sweeping, picking up toys, etc. Those can work working memory skills and self-control. So we can model those things and show those things and role play them as well. So we're kind of directly teaching those skills. And then songs like the Itsy Bitsy Spider, or kind of any song or chant with hand motions that can help with self-control or working memory or language as well. So just some additional kind of early childhood activities that we can do are those imitation games, so like follow the leader, that can help with working memory, attention, and inhibition. Active inhibition games could be things like freeze dance or Simon Says. That really does help to work on some of those impulse controls. They require kids to stop and start and also follow directions. Song games with movement, the hokey pokey, I'm a little teapot, head, shoulders, knees, and toes. Those all utilize working memory skills and get you some of that physical activity in there as well. Narrating play, so kind of watching and narrating helps kids kind of understand how language can describe their actions. It also kind of gives that positive caregiver interaction there too. Taking turns while sorting, and then sorting things, switching up the rules while sorting things can also help challenge some of that flexibility. And then movement activities. So again, obstacle courses or games that encourage complex motions can be helpful as well. So moving on to middle childhood, again, card games, board games, physical activities, movement, song games, strategy, reflection, musical instruments. So these might just be things that we're making more age or developmental appropriate. So, memory games, maybe Old Maid. Go Fish also kind of require tracking of information. There are specific concentration games out there, that can also be helpful as well. Games like Red Light, Green Light, Mother May I, Duck, Duck, Goose require attention and inhibition skills. Even fast-moving games like Dodgeball or Foursquare kind of have you adjust to changing situations real quickly. Songs that repeat, like Packing for a Picnic, Packing a Suitcase for Grandma's, Row, Row, Row Your Boat. You have to keep hold attention and be able to follow along with some of those things. So working memory, inhibition, and also some flexibility there. Puzzle and brain teaser books that have mazes, simple word finds, matching games, exercise your attention and problem solving also. There are games like that. Traffic Jam or Mastermind for a little bit older kids. Also learning to play an instrument. So that really does require working memory. It can also give a good outlet for kids to exercise some of these as well. In adolescence, or thinking about developmental appropriateness for some of these things, encouraging teens or people at this developmental stage to identify and establish specific goals. So starting with something fairly simple again, and then in something that's achievable, and then kind of slowly working your way up to longer term or more difficult goals can be helpful. Helping them develop these steps to reach these goals, helping them periodically monitor these steps also, and then consider are they progressing towards these goals? If not, what can we do to problem solve? Again, those physical activities, it could be organized sports, even yoga and meditation can be helpful, and those can be helpful for the physical activities can be helpful for obviously for any age or developmental stage as well. Strategy games, logic puzzles, those all can work, working memory, attention, and other executive functioning. And then some computer games do require constant monitoring, quick reaction, attention and inhibition as well. So that's one thing. Again, the autism community in action does offer some executive functioning school accommodations. So these might be things that you all might be familiar with, but these are things that can be provided that could be helpful as well for kind of getting across settings. So we talked about things that were in the home. So now we're kind of talking about things that might be in the school that could be helpful to kind of help generalize some of these skills. So again, frequent breaks, that positive recognition when we're doing things that are appropriate, we're giving that praise or that reinforcement or the reward. Choices, again, structured movement breaks, getting some of that physical activity in, advance notice of schedule changes, just giving some time to be able to adjust with some of those things. Preferential seating, if we need to sit closer to be able to pay attention a little bit better, sit closer to positive peer role models or to the teacher, that might be helpful also. And then some of those prompts or reminders to stay on task also. For assignments and tests, modifying things, again, we don't want to be overwhelming or overloading. We want to be able to give chunks that are doable to individuals. Extra time if needed. Checklists, again, that could be visual or written. Again, breaking large things down into smaller chunks. Assistive technology might be something as well. So speech to text or even text to speech. Oral administration of tests, giving kind of alternative test answers. So whether it's word banks, multiple choice, and then also the opportunity to work on assignments or take tests in a smaller setting that might be a little bit less distracting than a larger setting. Multisensory, again, teaching strategies might be helpful to help retain information and some of those working memory skills. Again, those step-by-step directions or instructions and explicitly teaching them at first and reteaching them if needed. Frequent checks for understanding, copies of notes, recording lectures, repeating instruction, those all might be helpful as well for executive functioning skills. And those organization and time management skills. So again, we want to make sure we're teaching these skills to kids directly if they don't understand how to use these tools. So color coding materials and assignments and having them understand the purpose and the reason why we're doing some of those things. Doing checks for, organization, binder checks, graphic organizers, again, visual, written schedule, and then alarms if needed. So it could be computer, phone, watch, visual alarms, those kinds of things. So talking specifically about high school and college, high school and college bring a lot of new responsibilities that can be overwhelming, especially for individuals with executive functioning issues and with autism. It might be the first time that, we're kind of having to use some of these independent skills and maybe not having as many educational supports, especially in college, as what an individual might be used to. And so that can really cause a lot of frustration. So there might be difficulties with organization, time management, staying on track, managing schedules, taking care of daily needs, and living independently. And so really transition planning is crucial for this. And so schools are, they start that process at age 14, but it might be helpful to start thinking about some of those things. Is community college a better option or a college closer to home rather than going far away? Really talking to their educational team and really making sure that there's a solid transition plan for that and making sure, that the students' needs are being met and that what are the best options or what are some things that we can do to put in place to help make this transition successful. That really is a huge help. And so just making sure that the transition is smooth, but then also that they have the right organizational tools or whatever tools they need to move on to the next step. So again, things like visual schedules, planners, alarm clocks, and explicitly teaching how to use those things might be helpful. And I know I'm coming up on time. So I just have a couple resources here that might be helpful. I found obviously the Autism Society has great resources specific to those transitions and post-secondary skills and needs, and thinking about how to make that transition smooth for individuals who might be at that stage. The Harvard University Center on the Developing Child's Executive Functioning, that's that PDF I was talking about, where I did share a lot of strategies that they have that they broke down by age, but I do have the link there noted if you wanted to take a better look. They have even more things recommended by age, but again, just keep in mind the developmental appropriateness. Nationwide Children's Hospital, their Family Echo virtual learning series. So they offer free 75-minute sessions to kind of learn, engage, and build skills around understanding, managing challenging behaviors, building family supports, also related to ADHD and autism. So you can check that out if you're interested in learning some more things about that. For the younger kids or developmentally, might be developmentally appropriate, Sesame Street and Communities has a lot of resources for emotion regulation. You can even just break it down by topic. They do have resources specific to autism as well. So they have things like interactive storybooks, videos, worksheets that you can print out. So it's worth taking a look there too. And then for anyone who else might be interested in the rest of the TED Talk that we watched, I know we watched a snippet, I have the link there as well. But I just have my references, and then any questions.
Dr. Catanese, what type of person would you hire to help a child learn executive functioning skills?
So people who are trained in it, I know there's some therapists or psychologists who would be trained, even I would even say, Wendy, even social workers or some people are trained in teaching some of those skills. So I would look for a professional who advertises that on their site, even talking to schools. There's a lot of time there's people in school buildings, if your child is still school age, that can work on some of these skills as well. And if your child or, the individual you're thinking of has an IEP, talking to the IEP team about who can help with some of these skills and building those skills into the school setting as well.
Okay, can executive functioning issues play a role in OCD symptoms? COVID has turned my son's OCD, especially hand washing, up to an 11.
So that's the thing with executive functioning, is that they can be impacted by environmental things. And one thing I forgot to mention earlier is that, executive functioning skills can even be impacted by how tired we are, or what kind of mood we're in. It can make you feel like you can't focus or pay attention if you have other things going on. So I would say COVID definitely is a factor. And if you're seeing, some of those things, I talked about earlier, anxiety and depression can kind of impact your executive functioning skills, and OCD would be the same. If symptoms are increasing, that can cause an increase in some difficulties with showing appropriate executive functioning skills too. And if those are concerns, obviously talking to a professional about how to reduce some of those symptoms or things to work on as well.
To answer the question that was posed by a lot of people, yes, this webinar has been recorded and we have the PowerPoint. So by the end of the week, they will be on our website at autismakron.org for your viewing pleasure. What type of tests are there by age level for measuring executive functioning within school, ETR, or IEP teams, and in private practice outside providers?
So I've used some executive functioning measures, and so it really varies on what the school might have available, what the preferences of the professional might be. There are some direct and then also indirect measures of executive functioning. So, rating scales can be completed to kind of get a parent or teacher, or even sometimes the individual, if they're able to fill that out, about what symptoms, they might be experiencing or what the parent or teacher might be seeing. And so some of those rating scales would be the brief or the Connors. They do look at, the brief directly looks at executive functioning issues, but then the Connors would be, looks at executive functioning, but also kind of ADHD related symptoms. And so anyone who's trained in those would be able to administer those. For kind of direct assessment, there are tests, standardized tests out there that have been normed and can be used by, again, professionals who are trained in them. So the NEPSI, the DCAFs, there's even things like the Stroop test or, different types of things like that. And if those are, questions, I have a whole list I can send Wendy later for a professional who might be interested in knowing those. So feel free to let her know if those are something that I can send over to you as well.
What about finding someone who can work on executive functioning skills in a child who is both deaf and has autism?
I would say that's going to be more challenging probably than some of the other providers, but you would definitely want someone who has experience working with people with those types of deficits. And so a good start might be looking and seeing on, who would be available who has experience with that, but also word of mouth. So if you already have a couple of service providers, maybe following up with them and seeing if they know someone who can work on some of these skills, or asking them if they've been trained on some of those things as well. So asking the providers you might be working with already or the school team, but then also I would follow up with societies like the Autism Society, but then also maybe deaf and hard of hearing associations and things like that too might have good resources directly for your needs as well.
And Dr. Catanese, if you could give me the list of those tests that you just rattled off, I'll get them to one of our registrants then.
Yes, I will make a note of that. I will send you an email after this.
Okay. Are there any other questions? Well, I want to thank you, Dr. Catanese. This has been really well-informed presentation. We learned a lot. There's so much in executive functioning, and you've really shined a light on exactly what we're working with and how to better establish routines in home and school and play, and how to be consistent, I guess. So
thank you all for having me. It's nice to be here with you.
If you want to learn anything more about executive functioning, my name is Wendy Klein. You can reach me at Wendy@Autism Akron. I'll do what I can to help you. And thank you for attending tonight. Good night.